Good evening, Berkeley. Thank you for joining us for this virtual town hall on the City of Berkeley's response to the COVID-19 pandemic. I'm your mayor, Jesse Adeguin. I'm joined by a number of city leaders, including our City of Berkeley Health Officer, Dr. Lisa Hernandez, Deputy City Manager Paul Budenhagen, and Deputy City Manager David White, who will be filling in for our City Manager, who's out of the office today. And we're also joined by the Director of the Department of Health, Housing, and Community Services, Dr. Lisa Varhus. And Dr. Varhus, amongst her many responsibilities, oversees the Health Department. And working with Dr. Hernandez is overseeing our coronavirus response. So thank you all for being here today. I know you're working very hard to not only respond to this pandemic and to keep our community safe, but I know that people of Berkeley really appreciate the opportunity to ask questions and to get information on our response and to help provide ideas about how we can further improve our response to the COVID pandemic. I want to start out by addressing something I know it's on all of our minds, which is the fact that the president has, and many people within the administration have contracted coronavirus. And I think this is just an example that we need to be vigilant and we need to follow our public health orders. And wearing something as simple as wearing a face covering and practicing physical distancing can not only help prevent you from contracting COVID-19, but can help prevent the spread of COVID-19. I think this also illustrates the importance, and I'll touch upon this at the end, of voting. This week, ballots will arrive in Berkeley residents' mailboxes and in mailboxes throughout Alameda County. And the decisions that we make now will help shape the future of our country and put us on a path where we can address this growing public health emergency and to create a just economic recovery to help support our businesses and our residents who have been struggling during this pandemic, and to make sure that at the end of this pandemic that we will be even stronger as a country. So please do vote, and please vote early. And I know there was a question around where you can drop your ballot off and where you can vote in person. I'll touch upon that later today. But it has been 7 months since the shelter-in-place order went into effect. And I just want to thank the people of Berkeley for your commitment and your support during this very difficult time. I know it's been difficult for all of us, but I'm proud of the fact that we have, I believe it's a 1.5% positivity rate, which is one of the lowest of cities in California. And our early action in Berkeley and in the Bay Area to shelter in place, working with our neighboring counties, and then the incredible work of our city team, who we'll hear from today, has been essential to control the spread of this virus and is going to be critical to get out of this emergency. So we received a number of questions, which we will address after some introductory comments on our response to COVID-19. It's been 2 weeks since our last briefing, and a lot has happened. And first I want to go to Dr. Lisa Hernandez, our public health officer. And Dr. Hernandez, if you can give us an update on the number of cases in Berkeley as of today. I know that there was a revised health order that the city had issued this Friday, and any other information you would like to share with the Berkeley community.
Sure, good evening. I'm trying new headphones. Can you hear me okay?
Yes, great.
Excellent, great. So I will start with Alameda County numbers. These are Alameda's numbers without City of Berkeley data, and then I'll do City of Berkeley data afterward. Just for Alameda County, number of cases are now at 21,028 confirmed cases of COVID-19 in the county, with 416 deaths. In City of Berkeley, our cases are now 718 cases. That's an increase of 47 from my last report 2 weeks ago. And our average daily cases are about 3 cases a day, which is a decrease from my last report where we were about 5 cases a day. So we are seeing a decline in those case rates and numbers that we're seeing daily. Deaths are now at 9. That's an increase of 1. So unfortunately, from the last report, we had an additional death reported to us in the city, in a City of Berkeley resident. In terms of tests reported to us on City of Berkeley residents, we're now at almost 56,000 tests performed and reported. We're at 55,881 tests performed and reported, and our average is about 733 tests per day, and that is about 500 tests per day over the target that we need to have in order to have a good idea of how disease is circulating throughout our community. And our percent positive rate is actually now dropped since last report Friday to 1.4%. So again, reassuring numbers. Every week, it seems like our numbers are lower and lower in terms of the circulating amount of disease in our community. So that is reassuring. Also for Alameda County, we look at that data as well and seeing how their case rates are doing. Their numbers bumped up a little bit in the last few weeks, and that seems to be attributed to ability of people able to get tested that hadn't been able to because of some of the test sites being closed due to air quality, and also people coming together more indoors. So that increased disease transmission. So it was increased transmission due to indoor activity and behavior because of poor air quality, and then also pent up demand for testing because the test sites weren't available county-wide. But when we look at hospitalization rates, we see that our hospitalization rates are decreasing. And we're continuing to carefully watch this data as usual. While this is reassuring, we also know that there are things coming up that will potentially change how a disease transmission will behave in the coming weeks to months. One of the things I do want to talk about is flu season. So just the shifting of gears from COVID to flu, another virus. This one we do have a vaccine readily available. So that's one of the things I want to encourage everyone to do here in the city of Berkeley is to get vaccinated. We know that the symptoms of flu and COVID are very similar. And if you become symptomatic with the symptoms of flu or COVID, the fever, the body aches, the runny nose, we may not know whether you have flu or whether you have COVID. So you're going to most likely end up getting tested for COVID, and you will have to isolate until hopefully that test comes back as negative. So we really want you to protect yourself with the vaccine that we have available right now, which is the flu vaccine. And that way we can reduce that transmission of that viral disease right now. As people may know, I want to remind you that it takes 2 weeks for your body to respond fully to the vaccine that you're given for flu. So if you get vaccinated today, it'll take 2 weeks from today to get protected fully. So we want to make sure people get vaccinated early. And that's not unique for the flu virus this year. It is what happens every year. I heard someone asked me that question the other day, and I'm like, this is not unique to this year's vaccine. So I really want to implore that people do get vaccinated. What I would suggest is that individuals contact their healthcare provider to see if they had the vaccine. Also, some of the pharmacies and even your Safeways and grocery stores have vaccine available. So that's another option. We are also providing pop-up clinics to high-risk populations within the community in the coming weeks. And we're hoping to provide more vaccine once it becomes available, also in our Ann Chandler Public Health Clinic, which we've done every year. So besides that, I'll briefly talk about testing. We continue to have our test sites available. The Optum test site, which is run by the state, but supported by City of Berkeley staff. And our curative site, which we had for some time as a drive-through pilot, is now switching back to the kiosk model, which they piloted first with us as well in the city. And starting tomorrow, they'll be back at the Berkeley Adult School for testing. And I'll talk very quickly about the health officer order. As you mentioned, Mr. Mayor, the order was issued last Thursday and posted on Friday on our website, which was in response to the county and the city moving into Tier 2, which is the second least restrictive, down the spectrum of the tiers for the city to be in. And we are not allowing all tier 2 activities to occur at this time. We're gradually opening up sectors with a focus on prioritizing schools to open, to ensure that there's a measured approach to having activities open with allowing schools to open if possible. So I'll talk very briefly about the other sectors that are allowed to open, and then I'll hand over to Dr. Varhus, who will talk a bit more about schools. So the sectors that are allowed to open at this point, actually the order was issued on Thursday, and starting on this Friday the 9th, these sectors can open. Museums, galleries, botanical gardens, and exhibition spaces may open indoors at 25% capacity. Gyms and fitness and dance studios may open indoors at 10% capacity. Personal care services, such as body waxing, massage, nail salons, skincare, piercing shop, tattoo parlors may open indoors, and they have to adhere to specific COVID restrictions. What is not allowed in that sector are any activities that require that either the service provider or the patron have to remove their face covering. So if either of those individuals have to remove their face covering, that service cannot be provided. And then libraries are allowed to reopen at 25% capacity. Last thing I wanted to mention also that's specific to Berkeley and Alameda is the outdoor live streaming and broadcasting and recording. That's permitted, and that's subject to specified orders that are in restrictions that are specified in the order. One of the things that is not open yet is playgrounds, but that hopefully will open later on in the next few weeks. We just didn't have the guidance came from the state right as we were releasing the order. So we will look at opening the playgrounds soon. At that, I will turn it over to Dr. Varhus, who will talk about schools.
I was having trouble with sound earlier. Is that still the case? No, good. I'm so relieved. So thank you, Dr. Hernandez, for your report. Thank you, Mr. Mayor, for again hosting us. Thank you to all who are joining us. It's a pleasure to be in the company of everybody here. So along with the health officer order that Dr. Hernandez released on Friday is the permission for elementary schools serving grades, transitional kindergarten through 5th grade, to be able to begin to open. And I want to be clear that giving permission to open is not the same as saying everybody needs to open or assuming that we have the authority to make everyone open. What we have determined with a lot of research, collaboration with Alameda County and other health officers, and just looking at what's happening across the country, is that we have contained this disease to the point where it is more responsible to allow children to begin to receive in-person instruction to the extent they need it to access their education than to not allow them to do so. We are working closely with Berkeley Unified School District and other private schools in the city of Berkeley to provide the support that they need and to encourage them to ease into this process in order to open their, first of all, there's a number of requirements that they have to meet in terms of the state. And in addition, in our local order, we are requiring each school to create a reopening plan that follows some very consistent guidance related to how to address, how all of the COVID prevention activities that we're talking about, hand washing, social, physical distancing, mask wearing, cohorting, and in addition are making sure that schools identify COVID liaisons. Each school must have 2 COVID liaisons. We are training those liaisons, starting with a collaboration with Alameda County Office of Education and Alameda County Public Health later this week, but then we will be actually following up with a more personalized, Berkeley-specific supportive approach so that we can provide ongoing consultation, capacity building, and support over the next period of time as elementary schools go into a phased reopening. There are some private schools that have been doing some preparedness that are much smaller, that have more space, that may be opening first or quicker. And we are working closely with Berkeley Unified and really guiding them around a much more phased reopening approach to ensure we can support the best possible safety for teachers, students, and families, and know that we are in close collaboration with the district. One of the things that we're working on with the district is securing some testing for all teachers and school staff, and we're looking at different opportunities for surveillance testing of kids. We do want to say that there were, of course, this is challenging for our schools at this time. I mean, we're all challenged by so many of this, and we have been sort of in this cocoon for almost 7 months now. So we should really work together as a community to be as patient as possible with our schools, with each other, with our families. This is a time for kindness and gentleness and curiosity and questions, as opposed to sort of responding with fear or anger or concern. We just think that proactive collaboration and communication is going to help all of us. We, as a city department in particular, are extremely committed to ongoing support for our schools as they begin to open.
Okay, thank you very much, Dr. Varhus and Dr. Hernandez, for that update. I know that there were some questions around the reopening of schools, and I think this provides useful information about the recent health order and the status of reopening public schools. I know that private schools, you had mentioned, have been developing their own plans to reopen within what is allowed in the health orders. So we can address some of those questions later on, but I know that we've gotten a lot of questions from parents about the status of reopening schools. And while this order does allow TK to 5 to happen, there still is a lot more work to be done in terms of testing, in terms of contact tracing, and then working with the employees at Berkeley Unified to develop plans and protocols to reopen our schools. So thank you for all your work and your collaboration with the school district on this. So now I'd like to turn the floor over to our deputy city managers, Paul Butenhagen and David White. Our city manager, Dee Williams Ridley, is out of the office today, but we are fortunate to be ably represented by our 2 deputy city managers. And Mr. Butenhagen is actually the EOC coordinator, and our EOC it's really like the multi-departmental strike team that's been responding to the COVID emergency actually since late January. And so he's leading the citywide effort with our public health officer in responding to COVID-19. So turn the floor over to Mr. Butenhagen.
Okay, thank you, Mr. Mayor. It's great to be here with you and with Drs. Varhus and Hernandez and Deputy City Manager White. Actually, all 4 of us are very deeply engaged in the work of the EOC. Deputy City Manager White is leading our cost recovery work with the team there. That's incredibly important and will live on past the actual disease containment response, which, we're all hopeful will end sooner rather than later, but we're prepared to go for the long haul if we need to. And of course, that work is obviously led by Dr. Hernandez and Dr. Varhus very ably, as well as, many other people. We've activated, over 100 people at the beginning of this EOC activation. We've got people from every department in this city who are working together to do all of the work of putting these test sites online and tracking down people who are COVID positive and following up with them under Dr. Hernandez's leadership, and working with small businesses and just a whole host of response, and obviously also communicating with the public about the work and about steps that they can take to protect themselves and their loved ones. So it's been a huge team effort from everybody in the city. I'm really proud of all the work that's been done, and want to also thank you, Mayor and Council, for all of your support of the hard work that the staff are doing. That's actually critical to the work, so very much appreciate that. We continue as a city to function very well, and you know, though most of our more staff than not are working virtually, we're still providing the services that we provided when people were here. So still very focused on getting the work of the city done. In terms of the EOC, Dr. Hernandez and Dr. Varhus went through really important overviews of the kind of disease containment, the health officer orders, schools, testing. I'll say a little bit more. One piece that we didn't cover was the work that we're doing to support vulnerable populations. And we have really focused on people that either have less access to services or testing, and or who might have a worse outcome should they contract COVID. So we've done a lot of outreach with our unhoused community. We have 4 different outreach teams that are out every week. They're providing public health information, they're providing food, they're providing water, hand washing stations, and porta potties are spread throughout the city. And also disease COVID testing is happening in the streets through a partnership with Lifelong Street Outreach and Street Medical Team that's doing a really terrific job. So want to mention that work is also happening. We have also opened Old City Hall as a cooling center for unhoused people, and we would welcome housed people if they were also feeling threatened by the heat. We opened 3 times last week, and we've opened 2 times previous to that. It's not air conditioned, but it is a big space that stays quite cool. We have cold water, we have air purifiers, we have fans, hand sanitizer, and we have space marked out so that people can be socially distanced, and people are required to wear face coverings. So we've, if we get more hot days over 90 degrees, we will open that Old City Hall, and people are welcome to come there. So want to make sure that people know about that. We had 38 people there last week. We don't have any over 90-degree days on the horizon for the next week or so, but we monitor it closely, and we'll open if we hit that kind of temperature. So the other thing that we're also doing in terms of supporting people who are more vulnerable is that Dr. Hernandez has done a great job with the team around making sure that these skilled nursing facilities and long-term care facilities all have really solid site plans, as do our congregate care homeless shelters. That's so they have, you know, a plan. They make sure everybody is, you know, they know how they're going to go about containing the disease if it shows up, how they're approaching people that are coming into the facilities, how isolation will happen, the whole gamut. So I want to also highlight that work and thank them for the great work of sort of proactive public health with congregate care settings where people who live might be at risk of contracting COVID. So with that, I'll stop and turn it back to you, Mr. Mayor. Thank you for the opportunity.
Thank you very much. So let's now turn to questions. We received a number of questions from Berkeley residents. And the first set of questions I'd like to direct to the city manager's office as they relate to operational issues. Is the city working on air-conditioned cooling centers for residents who do not have an AC and are in danger of overheating? You touched upon this a little bit in terms of the use of Old City Hall as a cooling center, as well as a clean air center. But I don't know if there's anything else you'd like to add, Mr. Budenhagen, around the city's plans to open up cooling centers.
So right now, that is our plan, is to do that at Old City Hall. So we don't have plans to open an air-conditioned site. We actually don't have very many air-conditioned buildings in the city. Yeah. If it did look like we were going to have a patch of really hot weather for a longer period of time, you know, we would pull back and try to figure out if there was something, but we don't expect that, and so we will stick with the plan that we have now, which is to open Old City Hall for those events.
Thank you very much. Was a question around Halloween. I know I've gotten a lot of questions from families about the city's guidance around trick-or-treating and activities on Halloween. the question was, are city streets that traditionally experience a large number of trick-or-treaters going to be closed and monitored, such as Russell Street?
I can touch on it if you want. We don't have plans to close those streets. We have put out messaging about Halloween, and Dr. Hernandez may want to elaborate a little bit on our public health messaging around that, around really making sure, we want to avoid large gatherings. That's part of the current health officer's orders, and Halloween or any other event is one where we would still want to follow that practice. So maybe Dr. Hernandez, you want to elaborate a little bit on the messaging there?
Sure. So we released a guidance for trick-or-treating and Dia de los Muertos, and pretty much, as you said, Deputy City Manager, any large gathering is not allowed by the health officer order or the state guidance at this point. So the traditional trick-or-treating would fall into that category, especially ones that also include block parties or gatherings in neighborhoods. So what the guidance has is it does provide some suggestions for what we consider lower, middle, and high risk activities. So I'll just list a couple. Low risk would be celebrating Halloween traditions like carving pumpkins. Other lower risk would be going to a pumpkin patch outdoors and wearing face coverings. Having a virtual costume contest, not as exciting as what you might remember from your trick-or-treating days of even last year. However, they are definitely safer. I remember trick-or-treating with my kids when they were little, and my proudest moment was like showing my son in his little fireman costume, and it didn't matter whether it was on a computer or just face to face, because he didn't know what candy was, but I really wanted to show off that costume. So those are still, showing off your kid's costume or your costume yourself is something you can do virtually. Moderate risk would be participating in a one-way trick-or-treating where there's goodie bags that are lined up for families to grab. Higher risk would be traditional trick-or-treating. So all those guidelines are on our website in a document that kind of breaks it down into those risk factors, because we know that we have to balance the fun of the holidays along with responding and keeping ourselves safe during a pandemic. So just hopefully that's helpful.
Thank you. So the old days of literally sticking your hand in a plastic pumpkin and pulling out candy is that's not going to happen this year.
Nope.
But there are ways to engage in Halloween activities that are safe, and we encourage Berkeley residents to visit the city's website for that guidance.
Yes.
Thank you. Couple of questions are in the schools, although we did touch upon this in sort of the opening comments. Question was, does BOSD plan on opening up their elementary schools? I don't believe there's a date yet, unless plans have changed. I know they're working internally and working with their health department on developing a plan to allow some in-person instruction. Dr. Vargas, I don't know if there's anything else you could share at this time on BOSD's plans.
Yeah, so what I can say is we hold and honor BUSD's authority over their school district and support them. They have to work with their community and teachers and families to establish the readiness, and we trust in their professional expertise and ability to do that well and safely, and know that they are our partners and committed. We have opened up the possibility, but then they have to determine within their own jurisdiction when it makes the best sense to reopen and how they want to do that. And they also have to balance that with the fact that they are still in classrooms. They're still instructing. They've established some practices that are having an impact and are supporting the educational needs of students. So they not only have to sort of carefully assess how they will reopen, but they have to balance that with ensuring that as they do that, that kids continue to learn and get the supports that they really need. And we're working with them and supporting them on that, and then honoring their authority as a jurisdiction to figure out what works best for their kids, for our kids.
So, we encourage parents to contact the school board and the district administration if you have ideas or opinions around the district's reopening plans. But as was noted, our public health department is working very actively with the school district to support their planning for their decisions on instruction. There was a contrary opinion that was expressed that I just want to note. This individual says that waivers do not make sense when it's not safe. Children are at the same risk as adults and the virus is contagious. Why not devote school resources to distance learning until it is safe to reopen campuses? That right now is the school district's plan till such time that they have developed and have implemented a new plan to allow for in-person instruction. There was a question around wildfire evacuation, and while not directly related to COVID-19, it does relate to the sort of the other risk that we face as a community, which is the risk of wildfire. We're in wildfire season right now. This resident is asking, are there places where people can take refuge in case of a fire announced prior to the fire starting? And they would like to know this information so that they can be prepared and know where to go. I know that Mr. Budenhagen, we have care and shelter sites that the city has designated, which are intended to be used in the event of a natural disaster. But I know that the fire department is working on some information to share with the Berkeley community about evacuation. And I'm wondering if there's anything else you could share with the Berkeley community at this time.
Yes, and I don't know if Deputy City Manager White may want to weigh in on this also. The messaging that we're really trying to convey to folks is that the best thing to do is prepare in advance of a red flag day and or a fire about where you're going to go. So, right now today, thinking about and planning for, is there a relative or a friend or a particular hotel where I can go so that when a red flag warning comes, I can have a place to go before a fire might start. So that, and particularly if it's somebody who's going to have trouble evacuating by walking in case the roads are totally packed. And that advanced planning is really what we're hoping that people will do. Also, obviously, we've been talking about COVID all night. One of the things we're trying to avoid is bringing a whole bunch of people together in a congregate setting. And so that's another reason why we're really trying to push the message of plan in advance, figure out a place where you can go, and that's going to be a lot better for everybody than firefighters or city staff helping people into some sort of a shelter or location like that. The other thing is that when fires come up, we don't know exactly where they're going to be. So we don't know what evacuation paths are going to make the most sense and or what sites would make the most sense for people to be at. So that's another thing that is sort of contingent on what the conditions are of the fire, but really want to encourage people to plan in advance. That's going to be the best outcome for everybody.
Thank you very much. Mr. White, anything else you'd like to add on this question?
No, I think Deputy City Manager Budenhagen covered it. I think the one part that I did just want to build upon was, what has made our EOC operations so much more dynamic this year was last year at this time, we were running an EOC to manage public safety power shutoffs. And, this year we've had to really integrate that work into our COVID response along with, the smoke that we've experienced from the devastating fires in the Bay Area. So I just wanted to share that, one of the things that we've had to spend a lot of time on is how to multidimensionally prepare for all these events that are occurring at the same time. And it's been pretty amazing to see the team coming together. So that's all I have, Mayor. Thank you.
Thank you very much. Okay, I'm now going to turn to several questions relating to testing and our public health orders. So I'm going to direct these to Dr. Hernandez or Ms. Varhus. There's a question on antibody tests. Since most tests are a snapshot in time, but antibody tests reveal if you've ever had the virus, why aren't antibody tests becoming more widely available?
Well, right now, the standard of care to diagnose COVID-19 is a PCR test. So that's testing for the actual viral particles and detecting it either in your nose or in your oral fluid or in your oral cavity. So that's what's the standard. The antibody testing is not recommended by CDC as a sole method of diagnosis of COVID-19. And just like with the PCR test, it's a snapshot. So you could be negative in the morning and then develop enough antibodies, and if you're looking at the antibody test, or have enough viral particles to be detected for having COVID later that day. So as the person asked, the question referred, there's two antibodies that are being tested, one that shows your acute disease and then one that shows your chronic disease, like if you've been exposed to COVID in the past. So it could be helpful for that second part, the chronic, like if you've been exposed, but it doesn't A, tell you if you have disease right now currently, and B, doesn't tell you whether you're actually protected at this moment for having COVID, because we don't have enough information to know how long we're protected from COVID. We have ideas, but we're not, it's not definitive. So again, gold standard is the PCR testing, which is not the antibody test. We will see more and more of the antibody tests come out, and especially when the technology gets a little more refined. And I'm hopeful that we'll have more technology and more information as the days to months go by.
Thank you very much. There was a very specific question from the owner of a dance studio in Berkeley asking, how do we determine 10% of our capacity? I'm assuming this relates to the public health order for a dance studio. It's a good question. I'm assuming it's like physical space, square footage. It would be the determination. 10% of your square footage, I'm assuming, is what the public health order is referring to.
Yes, I would say either that or what your capacity, 10% of what your capacity is based on fire code.
Okay.
So what you're allowed in there safely based on those standards.
Thank you very much. It's a question, if you're a student at UC Berkeley, live in the dorms on campus, but your home address is outside of Berkeley and you test positive, do you count as a Berkeley case?
Only if you put the Berkeley address, and this is a great opportunity for me to ask all students, all staff, anyone who is currently living in Berkeley but may have a permanent address in Idaho, Nevada, Los Angeles, even Santa Clara County. If you're living in Berkeley, you should put your Berkeley local address. That way we can work with you to make sure that you're isolated and that you're safe and you have the support you need to be able to isolate safely, and also to help contact your contacts so they can be quarantined. So that's what we're seeing, is that students may be using their parents' address or their permanent home address because they think they need to, because of the fact that their parents may still be on their parents' insurance, or their parents are paying their college tuition. But we really ask that students use their home address, their local address here in the city, so that we can support them and make sure that they're getting what they need to stay healthy and safe.
Thank you very much. There was a question around how long does it take to get test results. I think it really depends on the type of test you are taking. I know the curative tests they've reported you can get results within 24 to 48 hours. I know at the state-run health site, they usually say between 5 to 7 days. So it really depends on the method of testing and just the number of tests that they're processing.
So I think it's important to say something about that. Our goal is always going to be as quickly as possible, so that people can isolate if they need to, and we can do the contact tracing and case investigation. I will say that the curative site has been pretty consistent, 24 or even sometimes just under 24 to 48 hours. The state-run Optum site has had challenges that have been statewide related, as California ramped up very quickly to increase the number of testing over the summer. That really put a strain on lab capacity and led to delayed results. It has actually gotten significantly better here and there. I think the last I heard it was 2 to 3 days. However, people should know that when we're doing mass testing of this scale, once in a while, something goes wrong and a test doesn't come back as quickly as it needs to. So for example, there was one episode with Curative a couple of weeks ago where they had a problem with mail delivery to their lab. The mail was delayed by a day. And so people didn't get results for a little over 48 hours. And I think in 1 or 2 cases, 72. So just be aware that, everybody's trying to promise 24 to 48. It works out 90% of the time, but then there is occasionally a glitch because this is just such a new thing for us. And so you should definitely reach out if you're not getting your results after, say, 3 days, to find out what's going on in case there was a real problem. We encourage people to do that.
Thank you very much. I just want to acknowledge that we've seen marked improvement in the amount of time it has taken for test results to be provided. I recall at one point, because of just the large number of tests that were being conducted, that in some cases it was more than a week that some residents were waiting to get their test results. And I actually got my test at the Optum site and actually got it within, I think, 4 days. So I was very pleased to see the pretty quick turnaround time. So thank you for all your work to help improve the turnaround for testing, because I know it's so important, because if people are symptomatic, they need to know definitively, do they have it or not. But I think it's important to acknowledge that a test is a point in time. And so you may have taken the test and then you may have symptoms later, and you may have contracted COVID-19. And so the test is a good indicator, but it is a point in time. And so having the wide availability of testing is important to know definitively whether you have contracted COVID-19, and for us to be able to identify and isolate those that are symptomatic. So thank you for your work in improving the test turnaround time. There was a question around what is the city's plans to address UC Berkeley students gathering on Halloween? I think if people may remember, I think it was about a year or 2 ago, there was a large gathering of students on Piedmont and Channing. I've heard concerns from Berkeley residents around large numbers of students congregating on Halloween, not in compliance with our shelter-in-place order and requirements for physical distancing. I know that we are in ongoing communication with UC Berkeley around the need for our students to comply with our public health orders, but I don't know if there's anything else our city leaders would like to share on working with UC Berkeley to address gatherings on or before or around Halloween.
I would just confirm exactly what you said, Mr. Mayor. We're working with Cal in terms of doing outreach specifically to the students on campus, as well as the groups that are off campus. Actually was just in a meeting with them earlier today to talk about some of the efforts of coordinating messaging with them. So that's one of the things we want to kind of coordinate joint messaging to make sure that students are aware that this is a different type of Halloween this year. As we've seen in other holidays, this is an opportunity for students to socialize, and we cannot have that again, we'll see additional spikes in disease if we see those gatherings occur.
And Mr. Budenhagen or Mr. White, could you touch upon what should residents do if they see a large gathering? What number should they call? What does the city do when there is a large gathering or party that's happening not in compliance with the shelter-in-place orders?
Well, we ask that they report it. And so if it's obviously during day business hours, we ask folks to call 311 and to report that, and we route that to the appropriate enforcement entity. And obviously, if it's after hours, we would ask that they call 911 non-emergency line so that we can deploy the right resources to address any kind of gathering that might be occurring, because as it's been stated numerous times, large gatherings aren't permitted under our health order for a whole host of reasons, primarily to protect the health and safety of our residents.
I know that UC Berkeley has amended its code of conduct to state that violations of the health orders is a violation. And we've been in ongoing communication. I've certainly been in communication, our staff been in communication with UC Berkeley around coordination with UCPD and just education of students around the need to follow our public health orders. So hopefully through proactive communication and education, we can spread the word that large gatherings on Halloween are not allowed, and if they do occur, that there are consequences. So thank you. So, and I'm sorry to say that I really feel like I'm like the buzzkill here, but honestly, this is about the safety of our community, and physical distancing, complying with the facial covering requirements is really critical to control the spread of this virus. And while it is celebrating Halloween will be more limited this year, will not be as fun. This is really important for us to get through this and to be able to keep our community safe, and to hope next year that people can celebrate Halloween in much more widely and safely as well. So there was a question around outdoor businesses, and this is actually a question I've gotten from some local businesses as well. As we know, there's restaurants and other businesses are right now engaging in outdoor business activity. Some are participating in our parklet program to convert parking spaces into parklets to expand seating. But as we're approaching the winter months, this question was, how will we balance our public health response with also supporting our small businesses and ensuring they can stay in operation? This gets to a question that I know many businesses have asked, which is, what point will we allow limited in-store or in-business dining, similar to what San Francisco is doing? And I will note San Francisco is further ahead than we are. And so that's enabled them to take that step. And so wondering, Dr. Hernandez or Dr. Varhus or Mr. Budenhagen or Mr. White, do you have any sort of thoughts around what we can do to work with our business community to help them to transition, knowing that pretty soon the weather is going to change. And while we do want businesses to engage in outdoor activity, we are going to have to adjust pretty quickly.
Well, I think first I will say that that's one of the reasons why we're taking a gradual and slow approach to reopening, so that we can watch how some of the lower risk activities impact disease transmission, as well as allowing schools to open first if they are able to. And what we'll be watching, I think one of the parts of that question too is about what do we think, how will this mix with flu, and how are we going to look at the impacts of flu and COVID in terms of opening other sectors? Well, while flu is going to impact illness and people's health, it's not going to be factored into the reopening of sectors as we move forward. We're just looking at disease behavior and transmission of COVID, not of flu. And I'm hopeful that if we remain in a relatively low case rate and disease transmission, that we can slowly add additional sectors, including restaurants, to the reopening. But it's going to take some time, and we want to look at other activities first. Outdoors can still occur even with the winter months. You can have basically a tent or a covering canopy that has a weatherproof roof, and you can have one side that's covered, and then the rest has to be open for airflow to be maximized. So that's something that businesses have and will need to continue to be creative with. But I'm hopeful that we can move through this tier and potentially open additional sectors.
Thank you very much. Moving on to the next question. There were a couple of questions around playgrounds, Dr. Hernandez. And I know I've certainly gotten questions from parents on when will we allow playgrounds, play structures to be open, because right now many of them are fenced off or taped off. And wonder if you can sort of respond to some of these questions around opening up playgrounds for public use.
So it wasn't till last week that the state officially allowed playgrounds to open with their guidance. And I believe it was released Wednesday or Thursday of last week, if I remember correctly. So we will be considering the reopening of playgrounds soon. So when you talk about buzzkill, that's another buzzkill. I would say, I know that parents want, and kids want to play on the playgrounds. And if they look to the guidance of the state, there still is a lot of things that parents particularly will have to do to ensure that their kids are safe. Big thing as usual is making sure that their hands are clean and that they're not touching their faces, because we know that that happens. That's how disease gets transmitted, is with hands that are not clean and that they touch our eyes and our nose and our mouths. And kids are more likely to do that than most adults. So that's something that I would say to look at in those guidances, that there's got to be support from parents, more vigilant than normal, which I know sometimes seems like a lot to ask, but I think it's a doable thing. So we're working to get those playgrounds open as soon as possible.
Excellent. Thank you very much. Lastly, this was a question, but I think it's really sort of a statement, about considering the broader sort of public health and mental health impacts of sheltering in place in our community. And there's no question that the shelter in place requirements have, definitely had an emotional toll on all of us. And that's why, we have resources available for people to, not just, organizations like Berkeley Mutual Aid that supports people in our community to access groceries and provide emotional support for people, but we also have crisis hotlines and mental health hotlines for people to access as well. But certainly, sheltering in place has been difficult, not just sort of transitioning and managing working from home and parenting from home, and also sheltering in place, but also just the impact of being physically separated from people and not being able to, have as much direct interaction with people as we had prior to the spread of COVID-19. So we recognize that this is challenging, and that's why it's extremely important that not only not only do we continue to follow public health guidance, but that we focus on our own mental health and physical health as well. That's extremely important as well. And that you check in on your relatives and your friends and your neighbors, to make sure that they're okay. And that goes a long way, to helping support our community and making sure that we can get through this. I don't know, Dr. Hernandez, there's anything else you'd like to add on this?
I think you said it perfectly, Mr. Mayor. I had a phone call this morning from a old friend of mine. I shouldn't say a longtime friend of mine, not an old friend. She's hopefully not listening when I said that. But anyway, it's very, it's nice to hear people's voices, even if you don't get to see them, if you don't get to hug them, getting that connection in any way possible really does help. So it is definitely, I don't want to minimize the strain that this pandemic has had on our community. But I also want to use this as an opportunity to thank everyone for doing the best they can. And it has shown with our disease numbers, seeing how people are overall compliant. And I just want to thank community for being so supportive during this really tough time.
Thank you so much. Take the next set of questions. The first is around the election. And the question is, what options are available to voters who do not want to return their ballot through the U.S. Postal Service? And there are a number of options that are available. The city has set up drop boxes. Its city and the county have drop boxes where people can drop off their ballots. And I believe this information, Mr. Budenhagen, if I'm not mistaken, is on the city of Berkeley's website. In addition, the county has set up accessible voting locations throughout the county as well. So I believe there's 6 locations throughout Berkeley where people can drop off their ballots directly. One is in front of City Hall, 2180 Melvia Street. One is on the campus. I think several of them are at our city libraries. And so you can drop your ballot off directly in these drop boxes, and the Registrar of Voters staff pick it up on a regular basis. So you will guarantee that your ballot will be safe and that your ballot will be counted, because I know that that's a real serious concern for many people, given some of the issues of voter suppression throughout the United States. But in Berkeley and Alameda County, we have secure drop boxes where you can drop in your mail ballot. There are limited number of accessible voting locations in the city of Berkeley. This election is going to be completely different from previous elections. We will not have polling places at every precinct. This election is going to be conducted exclusively through mail ballot. But will have accessible voting locations available for people with disabilities to enable them to vote, as well as people that would like to vote in person. These accessible voting locations are larger locations, larger than the standard polling place, and that is to ensure physical distancing. And this gets to another question that we had received around social distancing and cleaning at these voting locations. As required by law, the actual voting booths will have to be more physically separated. I don't know, Dr. Hernandez, if anything else you are aware of around sort of the safety protocols that Registrar of Voters is going to be implementing at these accessible voting locations. The whole idea of having these accessible voting locations is to ensure greater physical distance while people vote. So I would encourage the resident to contact the Alameda County Registrar of Voters for more specific information on their protocols. But once again, this election will be very different, and not surprisingly, given that we are in a completely different world now than we were 7 months ago. But this election will be conducted very differently than prior elections, and it will be vote by mail. You should be receiving your ballot in the mail this week. And once again, I want to encourage everyone to vote early, and your vote matters. So once again, this information is on the City of Berkeley's website, where the drop boxes are, where the accessible voting locations are. My office will continue to get this information out to the community, and please vote. This election's more important than any other election in a generation. And please make a plan to vote early. So last question was, a couple last questions. One is about commissions. When are the commissions going to return to the post-COVID schedule? And when Mr. Budenhagen, we had a conversation about this at the agenda committee with the city manager, that we have allowed a number of the commissions to meet to focus on essential business. And I think we'll be discussing next week with the city manager sort of a plan for how to begin to transition to allow all commissions to meet again. But Mr. Budenhagen, you have any other information to share about this?
No, I think you've said it. I mean, we've allowed, commissions that have urgent, time-sensitive business that are critical to the city to meet. So Public Works Commission, Mental Health Commission, Planning Commission, various different commissions are meeting for those topics. And as you said, we're going to look more comprehensively at that next week and then come back. So
we deeply value the work of our volunteer citizen commissioners who dedicate their free time to serve our community. And while not all commissions have met, we are beginning to start phasing in certain commissions meeting, adjusting to this new virtual reality of conducting meetings virtually, which I actually think has been a positive thing. It's actually increased community participation in our civic process. And I think we're going to have a conversation after this pandemic around how to integrate the virtual and the in-person to more broadly enable citizen participation. But during this pandemic, under the governor's executive order, the requirements of the Brown Act, some of which have been suspended to allow virtual participation. I know there are conversations on the statewide level around looking at making adjustments to allow more virtual participation. So stay tuned for information. We're in conversation with the city manager, and some commissions are meeting at this time. Last question is, how does somebody get a meeting with you since you cannot meet in City Hall or at community meetings? I would be delighted to meet with any Berkeley resident or speak with any Berkeley resident. Even though we're not working in City Hall on a regular basis, I am working every single day, on behalf of this community. If you would like to schedule a meeting or have an issue you would like to address with me directly, you can email us at mayor@cityofberkeley.info. And those emails go directly to me and I will respond quickly. You can also call me on my cell phone. I'm happy to give you my city cell phone, which is area code 510-847-6249. Once again, it's 510-847-6249. So email us or call me directly. We're here to help. Even though we're not physically in City Hall, we are open for business and are responding to emails and constituent requests when we receive them. Once again, I just want to reiterate, I just pulled up the information on ballot drop boxes and accessible voting locations. So the ballot drop boxes in the city of Berkeley are at Berkeley City Hall at 2180 Melvia Street, the Claremont Branch Library at 2940 Benvenue, the Francis Allbrier Community Center at 2800 Park Street in San Pablo Park, the North Branch Library at 1170 the Alameda. There's a drop box on UC Berkeley on Sproul Plaza between Sathergate and Sproul Hall. And even though the campuses decided to close their campus to residents, you can go on the campus and drop off your ballot. That is allowed. The West Branch Library at 1125 University Avenue. So those are the 6 locations in the city of Berkeley, geographically spread throughout our city, where you can drop off your ballot in a secure drop box, and the Alameda County Registrar of Voter staff will pick it up, and it will be counted. So if you would not like to send your ballot in the mail, the accessible voting locations are at Berkeley High School, at the city of Berkeley's building at 1011 University Avenue, at the Ed Roberts campus at 3075 Adeline, at the Epworth United Methodist Church, 1953 Hopkins. The Lawrence Hall of Science is also an accessible voting location. Longfellow Middle School at 1500 Derby Street. the MLK Student Union, the Poly Ballroom on the Berkeley campus, Northbrae Community Church at 941 the Alameda, and Willard Middle School at 2425 Stewart Street. The accessible voting locations will be available for voting beginning on October 31st and will generally be open from 8:30 a.m. to 5 p.m. On Saturday the 31st, Sunday the 1st, and Monday the 2nd of November. And will be open from 8 a.m. to 8 p.m. on Election Day. So all this information is available on the city's website and at the Alameda County Registrar of Voters site, acvote. I think it's acvote.gov. So, so once again, please vote early, make your vote count, make your voice heard. Those are all the questions that we received today. Before we close, I want to give our city leaders an opportunity to make some final comments to the Berkeley community, and thank you for your participation tonight.
I don't have any really. I just want to thank you, Mr. Mayor, for the opportunity to speak with the people of Berkeley tonight. It's been a pleasure. Hope everybody stays safe. Thanks for the chance to be with you tonight.
Thank you so much. Mr. White.
I want to echo appreciation to you, Mayor, for hosting this event. I really value an opportunity to address our community and talk about really how important it is to work together to manage this virus. And I'm just really appreciative of all the efforts that everyone is taking to comply with our health officer orders. And again, just want to express my deep gratitude to you for this evening. Thank you.
Thank you so much. Dr. Barhus, any final words to share with the Berkeley community?
Just want to appreciate my colleagues, you, Mr. Mayor, for having us. And also just, I want to appreciate the community that's here and engaged and wants to know what's going on. We know that information is needed and wanted, and we do all that we can to get it out. And it isn't always quick enough or enough. And so thank you for showing up here. It's great to be part of this great city.
Thank you very much. Dr. Hernandez, anything else you'd like to share with the Berkeley community before we close?
Sure. I want to thank everyone as well here who's tuned in, as well as the support that I continue to get from city leadership. This is a unique time in the history of the world, the history of public health, and it is leaders like yourself, Mr. Mayor, and those here on this Zoom town hall that have allowed the community to be safe. I want to thank the community for being safe and being responsive to the orders and the recommendations from the public health perspective. And also, I want to thank my fellow City of Berkeley employees who have rallied and continue to support during this pandemic response.
Thank you so much, everyone, for joining us tonight. And I know our community deeply appreciates your leadership during these very challenging times, particularly that of our public health officer, who has really guided our community during this emergency and done so ably, and helping lead some of the regional conversations around how we respond to COVID-19. So we're deeply appreciative of your leadership and your dedication to our community. And I hope at the end of this, we can all look back and be proud of what we've accomplished, which is, as I said at the beginning, because of the early actions that we took, we were able to control the spread of this virus. And the fact that we have such a low positivity rate for a city of our size with a college campus is a testament to your leadership and the work of the Berkeley community. And so with that, I'd like to thank you all for tuning in. Thank you for your questions. And please continue to be vigilant. Please continue to be safe. Please continue to practice physical distancing. Please remember to wear a face covering when you're outside. And please remember that this is essential to protect you and to protect your community. Remember to mask on, to move on, and we will get through this as a community and be even stronger. So thank you all, and have a good evening.